I was diagnosed in 2014. I had a lump. There was there was an awareness program going on at a palliative clinic next to our school. I was in school then. I was in my third year of school. So they were calling on young ladies above the age of 18. So we went there, but I went there as a volunteer to help because I was studying nursing. I was pursuing nursing, so I went there as a volunteer to help with the palpation, and you see the clinical aspect of breast examination. Then after that was done, we suggested that we just check amongst ourselves. So that check is where I got. They found there was a lump. They sent me for an fine needle aspiration. That was 2013. Sorry, 2013 October, breast cancer awareness month. So when the results came back as no cancer cells detected, it was just a benign tumor. So by December, the tumor had grown in size. So there was a suggestion, I just go back to the hospital. Even if it is not cancerous, they just remove it. So I found a doctor who was doing his internship. I talked to him. He decided we scheduled a theater date, daycare, where the surgery was carried out and they removed the tumor. In that moment, they said we have to, even if the initial results of the FNA was negative for cancer cells, we have to check it again because of the rate of growth, and also the ultrasound had shown it is highly vascularized, the tumor itself. So we just sent it to a hospital in Nairobi. And the results came back, it was lobular carcinoma, invasive lobular carcinoma. So I was sent to Nairobi in the same hospital where they did they arranged to do a staging because it was grade 3 and I had taken so much time. They had to stage it, and luckily the staging was still stage 1. That was now 2014 February, during my birthday. Then I was in now 2014, when they did the CT scan, they did a CT of chest, abdomen, and pelvis. They found there was no metastasis, no signs of metastasis. So I was cleared for surgery the next morning. The next morning, I was cleared for surgery. I went for surgery at 1 p.m. or 1 p.m. on 3rd March. And now in that surgery, they did a procedure by the name BCT, breast conservation therapy, and axillary lymph node dissection. And so they said because the tumor is small, they don't have to do a mastectomy, but I'll have to go through chemo and radio. So I healed. During that period of surgery, I stayed in the hospital for 2 days, 48 hours, and I was discharged the 3rd day. I healed well. I didn't have any issues. I didn't have any complications, either surgical or any reaction to anesthesia. It was okay for me. Then I went to school. I had to wait the healing process to take place, 28 days before I commenced chemo. So I started chemo in, I think, late March. So my chemo cycles were 5 cycles. I did 5 cycles of chemotherapy. The chemo sessions, the first 3 were not, I remember the signs were alopecia and some nausea and vomiting. a bit of it, but I was able to, I had a good support system. My mom was around, so the support system really mattered to me because even the lecturers were a bit very supportive. And I didn't feel like in those, during my chemo, I didn't feel like I needed to miss any class because the more I got busy, I think the better it was for me. And then I was young, I was in sports, I was in clinical areas, so I felt I still went for a tournament, by the way, basketball tournament. Yeah, so I continued with my life. Uh, the fourth one is the one that a little bit put me down. My immunity, my neutrophils were a little bit low, but I came up after some hydration, antibiotics. I came back. I did the fourth and fifth, and then after a month, we had to reschedule for radiotherapy because I was in school and I had to go every day, and my school was a bit far from it was the treatment was in Nairobi, but the school was in Nakuru. So we scheduled for radiotherapy. I went for radiotherapy almost 4 weeks. I was supposed to go, I think, for 3 weeks from the last chemotherapy, but I went for it. Then I started, I did 25 sessions of radiotherapy. Just that my skin just got dark a bit. I didn't get a sore. The nurses there at the radiotherapy, they were very kind. I used to find them having, I don't know where they got the aloe vera. They used to keep aloe vera for us. Then when we come, they would give it to us. Then we apply like a moisturizer. So we did the radiotherapy, the 25 sessions. After that, we did the CT scans, the MRI. We did an MRI, by the way, which showed there was no evidence of the tumor, traces of tumor cells, so the cancer cells, that is. So they decided to put me on because my originally the histochemistry, I think the results were ER/PR positive. So they put me on tamoxifen, 20 milligrams daily, once a day, and continued tamoxifen. The journey through from surgery, I think also being a medical person, it helped me to know what questions to ask and how to go about it. The journey through from surgery to radiotherapy, it was just a bit of anxiety, I would say. Anxiety that really part of it was cleared by the fact that I was busy and I had friends and I was, nothing stopped, nothing like stopped in my life, whether it is continuing with sports or taking part in them and or education or friendship. I didn't lose friendship then. During tamoxifen is when I think I got some personality issues. I don't know. I don't know. Tamoxifen gave me some kind of issue kidogo. A bit. Kidogo means a bit. So tamoxifen was not. I don't know. I think it's just me because we were. I think we were three of us who used to communicate very closely, almost at the same age. So some used to say they get hot flashes and stuff. They used to get hot flashes and mood swings. And because I was a very outgoing person and happy person, my mood all of a sudden I had this different persona. I was keeping to myself. I think also I did not get enough information about tamoxifen. So I did my own research. And then the the findings I had about tamoxifen was about pregnancies and what. And at that age already I had completed school and I was working and I was dating and I was expecting to be married, get kids. So when I read about having to hold childbearing and infertility after chemotherapy and all that. I think that I don't think it was really the drug itself. I think it was my expectation. I wanted to be done with it and start a family. So there was a way I had planned my life, but anyway, God does the planning best. So I did the tamoxifen for 2 years. That 15, 16, 2.5 years, about there. Then I found out I was pregnant. So we had, the doctor said we have to follow up your pregnancy every month, and just to make sure there's nothing, there's no issue. And then we also have to stop the tamoxifen. So that's what happened. I stopped the tamoxifen. I gave birth. I breastfed for 6. The funny thing is, I breastfed one breast, and my daughter was the heaviest in the clinic. Yeah, she was just chubby. She was very cute, and it was exclusive breastfeeding. So I breastfed her for 6 months, and then after that we had to cut the breastfeeding after the 6 months. The 7th month, by the 7th month, I had resumed the tamoxifen. So I finished the tamoxifen, took them for a little bit over 5 years. Then that was it.
So, and then you completed it, and since then, do you still go for checkups, or what is?
Yes. So I completed the tamoxifen, and I went for checkup after a month after I completed. I went for checkup. I did a PET scan. Hey, when was it? I think 2022, early 2022 or 2020, early 2022, if I'm not wrong. I did a PET scan, and it was clear. It was okay.
Wonderful. And now,
So I just do checkups once yearly.
But you don't take any drugs anymore. You just go for the checkups once a year.
I don't take any medication. My life has been, my life is normal. So I do try. I try to really eat healthy, and the non-processed food. I don't really indulge in alcohol or smoking or anything of the sort. And then I love fruits, some of the fruits, some of the greens from the village. So we take that, and my life is just normal. I just take everything in moderation.
Wonderful. Thank you so much for sharing your story already from when you first encountered that something is different and you didn't expect it in the beginning, and then all the way to the point today. I would love to ask a few more questions so that also we can get a little bit a better understanding of also some of the events. How was it for you then when you were there? You shared that the very first time when you were kind of like also part of this cancer awareness campaign, and then out of the sudden you realized that you have a lump. How was it for you? How did you feel about it? Were you surprised, or what was going on through your mind when you the first time realized that something was different?
I didn't see it as a big deal because I didn't see it, the lump itself, I didn't see it as a big deal because I was young, I was pretty young. So I thought it was just the hormonal changes, fibroadenomas, I had never felt it myself. And I can't say I was very keen on doing the self-breast examination. So how would I even have found it anyways? So I think I thought it was a normal lump, just like any other girl who comes to visit the clinics, and they do they remove the fibroadenomas. So I thought that was going to happen, and especially after the first fine needle aspirate, where they said it was non-cancerous, but I need follow up. I don't know, ultrasound, something of the sort. So the ultrasound is the one that said it is highly vascularized. So and the doctor who did it in Nakuru, he looked concerned because the person who did it was a doctor. It was a radiologist. So he asked my age. I told him, and he was a bit concerned because it didn't look like a fibroadenoma. So that's where the concern came in. Now I started to a bit get worried, but I was really busy. I was busy. I was all over. I was the games captain then. I was so busy, so I didn't really take time to think about it in that way. So when he said, you need to remove it, and then after December, I decided to remove it. And after 14 days, it came back with those results. That's when I realized. And then the person who gave me the results, I did not think they were my results. Yeah. So he was not expecting it was me because I think he just looked and I think he didn't read the age. He just told me my face. He said, "Hey, this person is this is not good news for this person." So I read that it was a very long report. Some of the things I could understand, some I could not. So when they wrote there lobular carcinoma, invasive lobular carcinoma, grade 3, now I had to Google. I was in the street then in Nakuru. Then I went back to the doctor who did the ultrasound. He read it for me and gave me the results, and then he repeated an ultrasound. He saw the mass is still there. It has not moved. It's not gotten to the basement. So he said I have to go to the hospital like ASAP immediately. You need to consult a specialist immediately. He gave me some recommendations. I went back to the doctor who did the surgery. He's the one who connected me now to the breast surgeon, who was very, I'd say, he meeting that breast surgeon was like a life changing, because if I had met another person, I don't know, he made me feel at ease, you know. He really made me feel at ease. He made it very he made it very easy for me. Being a medic, he would explain like like a layman, and he would consider all other aspects, my finances, the fact that I'm a student, I'm from a humble background. So he put that all together, and he really did help me. So that was it.
That's wonderful that you met this surgeon and he really helped you and helped you understand and considered all the aspects. How was it then? It seems that a lot of the information was given to you as a person individually, but how was it then for you also to communicate maybe with your mom about it or with other people about it?
So when I found out the report, I went to school. So I didn't know how to tell my mom. So I told her friend. Yeah, I told her friend, and her friend went to my mom's place to tell her. They live nearby. So when my mom was told, what she tells me, because I looked around, she tells me she was shocked. She was cooking, she stopped, she was shocked. And then, she didn't understand if what she says that she didn't get it, that she didn't get that cancer has stages. Like there is an early stage. So we have family members who had died from cancer. So I think she was, the only thing she could do at that time was pray. So she prayed about it. And then she didn't have internet. They don't have those internet phones or access to the internet. So she just came. When she came, she tells me she was expecting to see me very sick. But she found I was I was out and about. I had done surgery. She came after surgery because the moment I arrived, she was being told after I had already traveled to Nairobi. And when I arrived, I found the doctor, he sent me for the CT scans and scheduled me for the following day. And you see, from my place to here, it takes almost 24 hours, 18 to 20 hours there. So she came when I was already scheduled for surgery and I had gone in. So she found I was very healthy. It's just that the doctor made it easy for her too and explained everything, the staging and differentiate the stages of, my mom had seen people who had like wasting, who had gone through wasting, the end stage. So he explained all those stages to her and what they had done, why I had Potovax. Yes. So to my mom and my dad was explained too by my mom. My dad did not have the courage to come. So he used to call my dad and my brother. And then also I think they could not afford then. They couldn't they also wanted to chip in a bit to pay the hospital bill because the hospital they put me in a welfare program. That is something I'm always grateful for. And so my mom really wanted to, whatever she had, at least to save it up and also chip in a little bit to give back. Yes. So that's how the information spread from me to my mom's friends, to my mom and my family. Not many people got to know about it. So people got to know about it after now after I think the treatment, most probably around radiotherapy season.
You deliberately said it is something that you go through and your family goes through, and you didn't want to share it with others? Or what was some of the reflections that you had, if you had some reflections on that, shared with others or not?
I didn't feel I can't really quite say at that moment because everything was so fast. So I really wanted it to, yes, there are people I told, some of my friends, very close friends, and they didn't come. So I didn't feel like I really needed to force. I felt like, I don't know, I just felt like I would be forcing people to be there, So the people who are there are my family and friends from current school. My roommate, her friend, my classmates, some of my classmates, they used to call, and that really felt nice. And then I didn't worry so much about people who knew and didn't. Okay, not that I didn't worry. I didn't get that time to think about it then. So I thought about it later, and that really somehow emotionally takes you back, and a little bit you lose some people because you don't want to accept them back regardless how good they are afterwards. So I felt when you get support from family, I think family is the most important part because my mom and a cousin of mine, I used to live at his place. And during those episodes of nausea and vomiting and dehydration, he's the one who would take care of me. It was a male cousin of mine. So those family members, I think that those were the most important people to me at that particular moment, because at first, like I said, it was very fast, the whole process. And then I was also very, how do I put it? We were so, and they were very supportive. I didn't get to realize who is there and who is not there. I got to realize it later. So I didn't feel lonely, or I didn't feel abandoned. I did not. Mm.
That is wonderful that you had such a social support net around you and the relevant people were with you and were standing with you during that time.
The only problem was they were not very well informed. Yeah, so they would, I would hear them talk about it, and or talk about cancer and the causes of cancer and the prognosis of cancer. And they would think I'm in the bedroom asleep, but I would hear them talk about it. So, but they were not very well informed. So I'm the one who would inform them later and tell them, I heard you talk about this. So they would ask me, how many, they would ask me very weird questions, like very personal and private questions. Yes, they would really go deep into asking me, why at your age? They would really trigger me sometimes. I was like, I've always been a good person, so I don't know why.
You already mentioned that because you have a medical background, a background in health, it was possible for you to ask some questions and try to figure out what were some of the questions that you asked that helped you to really understand the disease better, the treatment better. So what helped you? What questions were crucial for you during that time?
So the first question during diagnosis was when the doctor explained about the surgery options. He did not. I didn't. He did not put an option of mastectomy in my. Yes, he told me I do not want to do a mastectomy on you, but we will have to remove some of the lymph nodes and take them to the lab and test. So my questions were around, what if you don't get to remove the whole tumor cells, the cancerous cells? He says the tumor is very small, and he'll also remove the margins around it and also test that as well. The other question was, what if the lymph nodes turned out to be reactive, So, and he said that will be tested and we will know, and that will guide also on the chemo that I will get. Now, there was the grading part. You see, staging and grading is different. So I also asked about the grading. That I asked later about grading, what it meant by grade 3, grade 1. He said it is the aggressiveness of the cancer cells. Some other questions were about my psychological well-being, and that was provided back in Nakuru, because I really needed to talk to someone, and we were very young. All my colleagues, all my classmates were young, so I knew I would not get some very good psychological support. They would just say something that I want to hear, I needed someone to talk to and tell them my fears, and I was not very open then. So I needed someone who I would really trust, like a professional. And then the other questions, I added weight during chemo. So yes, I added weight during chemo. So, and the hair loss, those were the questions surrounding the whole scenario. The hair loss, how long it will take, how many sessions it will take for me to start losing my hair. What are the side effects? What if I'm not able to completely feed? But that never happened. And I was reassured even before. And also now some advices I got were taking care of myself, avoiding crowds, using masks. And then, the masks were not very popular, but we had to. Um, Other questions were around my fertility later, after chemotherapy, and cardiac issues. After there was a chemo that's not very doxorubicin, I think it was. Yeah, doxorubicin. So they had to do a cardiac evaluation before I received the chemo. So I asked how after the chemo, do I still continue doing cardiac evaluations and stuff? It's never. They say it's not very kind to anybody with a cardiac issue, so they have to check for dosages purposes and also if there is any alternative. Now for fertility, they said I'm still young, so there is a big uh, uh, possibility that my fertility will not be altered very much, because in my head I wanted some kids, some kids afterwards. So I believed I wanted some kids, so I didn't want to joke with that. And they also had options about fertility, what you can do if you're worried about it. You can go to the gyne. They can freeze your eggs. I think it's just preserving your eggs. But mine went well. I didn't need to go there. Other questions, most questions for people like me are usually around, apart from that, it's also around the economic factor. Are they going to afford? How much will it cost every 3 weeks? The total cost. Does the hospital allow them to pay in bits? So, but because of the welfare, I thank God I did not have to ask those questions. But I did try to chip in. My parents tried to chip in. I used to pay. Sometimes when they have money, I used to take it to welfare. And now the other question was what the genetic, the BRCA genes, and how I can do it and where it can be done. It's not available in the country, so you have to do it. You have to send the specimen to another country. So that was not an option for me because I could not afford that one. But I was asking, and also I had some people asking about if they can get tested because of the age at which the cancer was diagnosed, for future, prevention strategies from maybe my daughters or even other relatives. Also and also family planning, sorry, I forgot. The family planning methods that I am allowed to take. But those are not questions I asked. Those are that's an education you get from the hospital. You're not to use any hormonal family planning methods. Yeah.
Thank you so much for sharing these questions, because they're really, really relevant. On the one hand, they were relevant for you, but they are also relevant for other people. And sometimes we simply forget to ask the right questions or asking questions that concern us. So thanks for sharing the questions that you asked and that were relevant for you. You also mentioned that there was this one time when the decision was done that you need to have a mastectomy. How was that for you? Also, maybe linked to the question of family planning and so on.
So for mastectomy, the decision was the doctor said I will not be going through mastectomy. But for me, I had already talked to someone who had undergone a mastectomy. So she said it's more it's more about your life than preserving all the other things you'll get prosthesis, you can do a reconstructive surgery later, but at that particular moment, the doctor will do what is best for you. So the doctor said, if I go in and I find uh, the edges of the tumor, and there's a possibility of metastasis to like a distant metastasis, I will do a mastectomy, not distant, local invasion of other tissues. We'll do mastectomy, and then that will be it. So when I woke up and I found I still have my, I had signed already the consent. So it was not about, it really didn't worry me that much at that particular moment because I had seen other ladies. The doctor had called some people to talk to me, and that was another part of my like an information where I got information from any questions I had, like social and personal questions. Then when it comes to family planning, I did not ask the question on family planning. They said if I get to that stage and I need to do family planning, at no given time should I use a hormonal therapy because the ER and PR were positive. Yes. So that was it. So my partner came in after I was treated. So he came in when I was taking my tamoxifen. So and to me that was my it was me it was me who was given the opportunity to make most of the decisions about our sexuality and our family planning. So my partner was, um, being a medical person, was very understanding and give me that liberty to make the decisions for myself when I want to start a family, how I want to go about it. Yes. So me, I decided I wanted to start a family immediately. So I got so when I got pregnant, afterwards when we decided now we don't have we like he said, he advised, you've already proven that you can get a child. You don't have to prove it again. So please take your medication, finish the treatment, let's do the investigations, the PET scan, and so on, and then we can now move forward from there. So the decisions about planning a family has really to my advantage. So it's really me me making the decision, and him does not have a problem with that. He's never had an issue. And the funny thing is, we thought we will take long before I get pregnant again after, but I did not. After after my first child, I did not struggle. So I would say, like the doctors had advised it with the young age. I think came in handy that I I would be retaining fertility. Yes, they do a score. I think it's called Mullerian scoring something. I think that my score is not a perfect score for my age, but it's not a bad score. Mm. So I'm grateful.
Absolutely.
Currently, I'm expecting the second child.
Wonderful.
so so I'm happy about it.
That's wonderful news. And it's
Mm.
wonderful also how you describe your partner supporting you in that and that you're walking in it together.
Yes.
In all
Yes.
these
When a partner is supportive, it's and understanding is really important for peace of mind. And also, you do, the the surgeon who operated on me, he told me after the PET scan, he told me, don't live in fear, things happen for reasons known best to God. So after the PET scan, I have just been myself back to normal. So I know everything will be fine, and I am hoping for the best. Right now, my mental health is very good, and I don't have that fear of recurrence. I don't have. Yes, I read about it, and I am very much inclined towards oncology, whether it is research, whether it is um, work, job, such. It's so much inclined to oncology, but at the same time, I don't let my past define me so much. So I have to be my own person, and the support comes from my family, my now my husband and my daughter, and also my parents and my parents-in-law.
It's wonderful to have all that support. Some people say that when they undergo a cancer therapy, they're also changing, they're also learning something. So, what would you say when you just mentioned you are back to your normal self, like you were before? Is this how would you describe it, or is this something that you also learned through the chemotherapy, which is still, or not a chemotherapy, but through the entire process that you learned and that you want to share with others?
I feel my journey, my individual journey, it's I'd say I learned to be very patient. I was not a very patient person. I learned to be very patient, to take one step at a time, and also to really navigate through, to be resilient, to really navigate through your issues, because everybody is going through something. So at the end of the day, you have your life to to fight for, and also for other people to be happy around you. You have to, you're your biggest commitment, yes, but you have to be very, very present. I realized during that journey, I think I was everywhere before, but I realized when I am with you, like when I'm with my family or I am with my friends, um, I I've become very present. Like I'm I notice very little things. I'll notice how you say something, why you say it. I'll want to know why you've said what you've said. Like I want to live those moments. I want to feel every moment. So that has made me more happier because I get to notice the the what my presence, what happiness is created by me being present. You know, what are the emotions that are attached to my presence. So those are the things I have learned, and I've learned also to really value what I have, and that is because during that journey, you go through that journey with other people, and you realize you might not be having a lot of money or even pay, but the fact that you have support and people calling you and even praying for you back at home is really a blessing on its own. So that is something, the people who are there are people who, if they called, even if it's 1 a.m., I would wake up. And then my husband tells me, you and this, your friends. But you have to really be present in those people's lives because they woke up at 2 a.m. for you. So, of course. So, going back to my normal self, I meant going back to my bubbly self, not thinking about it so much, not thinking about uh, what life is about, being a cancer survivor. No, I'm a normal person. I am, yes, I went through cancer diagnosis and treatment before, and it altered maybe the shape of my breasts, you know. I have some scars and so on and so forth, but that really doesn't define me at all. It's I am back. I appreciate, and I usually tell myself and my husband sometimes that after I am done giving birth, I will go for reconstruction surgeries. They are there, and they are there to to give you another chance on how you look at life and yourself too. So I am content. And I'd say I'd hope people who get the diagnosis, um, unfortunately, yes, it is sometimes heavy on them, but I would hope that they don't look at what they're losing in the midst of all that. You lose, but you don't lose much. It's just a little bit, just some time that you have to and that time maybe you would be somewhere doing something else, and then learn from that experience. Learn to appreciate time, time, value, value people, be present. I usually say you have to be present. If I am with you and you're not present, I just can't. So I think that's it. For it's a journey. Yes, we call it a journey because everything about life is a journey, no matter how short it is. But it's a journey. But we can all maneuver through it and less about each other. If somebody says, please lend me, I have a platform, I need people to chip in and help me financially, even emotionally, pray for them, support them, whatever you have, just send so that this person gets some hope. So for people who are cancer free, or people who've never been diagnosed with cancer, maybe the screening is very important. And considering the government and other entities, the private sector, they try their best to ensure there are camps for screening, or even you can walk into a government hospital and request for screening. Just do it. It's very, very important. Early diagnosis saves you time, it saves you money, it saves you emotional, turmoil for you and your loved ones. And also, it gives you a lot of hope and courage to face the whole treatment process. For the cancer patients, it will get better. I'd say it will get better with time. The hair will come back. The weight will come back. Some of them add weight. So for those who lose weight, the weight will come back, the appetite will come back, but all in due time. So I do pray that you keep on holding on the courage to keep on fighting. For the caregiver, don't lose hope, rejuvenate, try and exchange, try and take breaks and, change shifts with another person so you don't get, worn out. And also you can also go for counseling, just like the cancer patients. Talk about how you feel, what you feel you're losing, or what you're not gaining. So that is also another way to, try and take care of your inner peace and also your mental health. Let's say for the government as a whole, supporting cancer patients, cancer does not, it does not discriminate, and it does not look at the age, the financial status, and for the cancers that we can prevent, like the cervical cancer, the government is really capable of doing so by enhancing, quality care, immunization schedules, just like for the under fives, and also that is for women against the cancer of the cervix, and also promoting and promotion, and also emphasizing on, screening strategies for those cancers. And also the other entities that are able to give, a bit of welfare here and there for treatment of these patients, and also ensuring that these treatment plans and protocols run throughout, that they don't run out. You know, if it is a radiotherapy machine, it's broken down. Let's put emphasis and also try to see how we can help them. They don't miss their treatment and all. So that will be all. And for the general public, if a cancer patient calls out for help, our population, in our country, people are very empathetic. I'm telling you, if people are easily touched. I've seen stories in YouTube about other countries, but in Kenya, me, I know firsthand. People are easily touched and people support each other. People who support you are people who you don't even know. So that is very good. We should continue the same spirit. When people call out, please listen and also please chip in a bit. Yeah, that will be all. We keep on educating ourselves. It's also very important. We keep on knowing our own bodies, realizing how we are, so that in case something goes wrong, in case something is out of the normal, you are able to rush to the hospital. And if you feel you're not satisfied, you can always request the physician or anybody who is seeing you. No one will question you for asking a second opinion. Nobody. I've never seen a doctor or even a clinician judging a patient by asking for a second opinion. It doesn't work like that. They even recommend it. So please always ask for a second opinion, not hesitate.
Thank you so much. Oh,